Hmm. I think we are live now. Am I audible, visible to all my friends? All right. So I think yes, good to go. Dr. Kajal is here. Dr. Ambika is here. Ravi Teja is here. All right. So I think I'm live now and I'm visible, audible to all of the attendees. So a very good evening to all of you. I'm sure that you are preparing well with us at DocTutorials. And this is a special series, what we are doing at DocTutorials. Every week we are having a kind of test, a very special test that this time the educator is giving. Okay, so this is also the first time I will be having the experience and I'm as excited as any other student will be. So like, you students must be considering कि मैडम को तो सब आता है, मैडम ने टेस्ट बनाया, बेटा ऐसा नहीं. I don't know who has made this वाला test, but I'm sure the questions are definitely framed by me. But like solving it here in front of all the students as in a particular timeline would be difficult process for me as well. But this session will tell you students that how to go through the ophthalmology questions. So especially today I have taken a mini test where the questions are created by me, but they are all wonderful questions if you are going for a NEET PG or an INI set exam. So, many students come to me, they ask me that, ma'am, ophthalmology is supposed to be a very tough subject if we talk about MCQs in, INI set, NEET PG. So, I also say the same. Yes, the level of the questions are not so easy that they give in NEET PG, but they are doable questions, bache. If you have studied once ophthalmology by me through the app or any other live session, if you have attended, like we are going through live session these days, you must be knowing now. So if you have attended ophthalmology by me, I make sure that all my students understands the concept well. So whatever question is there in any twisted form, I make sure that my students are able to understand that. Okay, so that is, a way of teaching that difficult most subjects we try to teach, we try to make in a easier way for our students to crack. So this time also I have taken a mini test, like we will be going through it, and I'll tell you the tricks and tips. I'll give you some tips that you can go through and you can enjoy reading all the questions that we have created at the DocTutorials. I'm sure you must be knowing that this is the only faculty curated Q bank at DocTutorials, the only one in the country. Dr. Sanskriti, I also consider that this is a little difficult subject to remember, because ophthalmology is one subject which, most of us have read least in MBBS. Third year is the time, it's a leisure time, isn't it? First and second year you get bulky subjects. Third year is a leisure time where you get comparatively easier subjects, and this is the time when you can do all kind of things. You go to fest, you enjoy your college life because your final year is about to come. So ophthalmology is one such subject which we do not read very nicely in our undergraduation, and by the time we are through with our internship we tend to forget this also. Okay, so this kind of thing which makes the subject little difficult for our students to understand. Yes, okay, so shall we begin without wasting much time? Shall we start the test? I request all my students to also try to attempt all the questions with me. Okay, this is gonna be a test for all of us, so let's get started. Shall I start? Because I am seeing all your chat on the YouTube channel. So, shall we start the mini test? If you are aware of the DocTutorials app, if you do not have that, students, kindly download it right now. Log into the mini test that I am also going to do. And here we have our test series. Okay, if you can see these mini tests, we have all the subjects given here. We have created it in a lovely fashion that you can see the image based questions differently. All the subjects are given very nicely. There are a number of tests given, so if you go through ophthalmology, a lot of mini tests are given that you can give. And today I have taken this one, ophthalmology T20 questions. So this is a 20-minute test, beta. Shall I start with that? So let's try to solve all the questions in 20 minutes. Okay, so these are some general instructions. I'm not reading that, though one should read all the general instructions very properly. Okay, very nicely you have to read that. So I'm saying I have read all the instructions and I'm just starting the test. Okay, chalo, let's start with the fun here. So it says that there is a old patient. Okay, old patient hai. There is a complaint of diplopia of sudden onset. So I consider diplopia of sudden onset. I have read that it should be a paralytic squint. Okay, first thing which I know is diplopia of sudden onset is probably a paralytic squint. Now there is a history of diabetes and hypertension. ठीक है, old है, diabetes है, hypertension है, agree. Okay, now he came to me. There is a diplopia of sudden onset, and when I checked, vision was nearly good. Okay, vision was 6/9, which is supposedly a good vision, isn't it? Now early cataract bhi hai, theek hai, old hai, early cataract expected hai. Now when I checked the retina, retina was normal. Pupil showed both the absent direct and indirect light reflex on the right side. So what he says, diplopia हो रहा है, रेटिना नॉर्मल है, विजन नॉर्मल है, but pupils में direct light reflex gone, indirect light reflex is also gone. Now quick answer, what should that be? My answer is third nerve palsy. Am I right, my dear students? Now how I have reached to this, I can say, beta, if this is a second nerve palsy leading to a diplopia, first of all, this is not possible. A cranial nerve to optic nerve paralysis will never give you a diplopia. It will give you a loss of vision, isn't it? If your optic nerve is gone, it will give you a loss of vision, but here vision is absolutely normal, so second nerve is absolutely gone. Okay, now many students will confuse with this. Pupil shows absent light reflex, but beta, light reflex is absent in both the things, direct and indirect, both light reflex is lost. That means when I show a torch of light here, pupil is not reacting, direct light reflex is gone. When I show a light here, this pupil is again not reacting. That means efferent is also gone here. That means the problem lies not in the afferent but in the efferent nerve, and efferent nerve is the third nerve. Can I say that? Now sixth nerve definitely gives you a diplopia, definitely, but in such a condition pupil is absolutely normal, so sixth nerve be out hai na. Seventh nerve definitely is not a possibility here, because seventh cranial nerve does not supply the extraocular muscle, it supplies the facial nerve. Facial nerve doesn't move the eye. So my answer would be very easily, I'll go with option number 3. So what we have learned very quickly, we have learned कि third nerve palsy में diplopia of sudden onset, retina normal, vision is normal, but pupil will give you direct, absent and indirect light reflex. So quickly I'll move to the second one. Now second says, which statement is correct about cover and uncover test? Ab cover test fatafat, I know cover test, that cover test is for tropia. तो ये तो गलत है, डायरेक्ट कवर टेस्ट इज नॉट फॉर फोरिया, इट इज एक्चुअली फॉर ट्रोपिया. Cover uncover test confirm tropia, no no no, cover uncover is actually for foria, so this is also out. Now in cover test the squinted eye is covered with an occluder, no, in cover test rather the normal eye is covered, so ये भी गलत है. Now alternate cover test helps to distinguish comitant from a paralytic squint, so definitely this is my correct answer. क्यों करेक्ट आंसर है? बिकॉज फर्स्ट ऑफ ऑल थ्री ऑफ देम आर एब्सोल्युटली रॉन्ग, एंड आई ऑल्सो नो दैट ऑल्टरनेट कवर टेस्ट में I can see what is the secondary deviation, what is the primary deviation. So that tells me that is this a comitant squint or an incomitant squint. So I will quickly go for that. Okay, now what is my third question? It says that there is a young male 30 years old banker by profession. banker है, थोड़ा टेंशन दिखा रहा है, banker है टेंशन. अभी वो कह रहा है कि young man है, blurring of vision है. On examination there is also a halo around macula. Young man, banker, halo around macula, this is definitely a patient of CSR, definitely. तो मैंने वैसे ही CSR सोच लिया, बट आगे क्या कह रहा है? Vision is less and there is no history of any glasses. Okay, refractive error is out. But now the moment you give +2 का चश्मा से vision should get better, because once the fluid gets inside and you give a 2 hypermetropic correction, the patient has a improve in vision. Now it also says कि बार बार अटैक हो रहे हैं और रिस्पॉन्ड वेल कर रहा है, दैट मीन्स डेफिनेटली इट इज गोइंग टू बी CSR. CRAO इन यंग में लॉस ऑफ विजन होएगा, ऑप्टिक न्यूराइटिस में समथिंग विल हैपन टू द प्यूपिल एंड विजन विल नॉट इंप्रूव. AI एनोइंट्राइटिक इतने यंग पेशेंट्स में होता ही नहीं है, दिस हैज टू बी अ CSR. यस, Now, a patient has a normal right gaze. Right gaze matlab aise dekha to absolutely normal. Now attempting a left gaze, his left eye is going here, but right eye is not going here. See, one gaze is normal, another gaze mein this is normal, but this is not going. So definitely this is going to be a right-sided MLF lesion. It can't be right PPRF. PPRF hota to pura right gaze gone hota. Agar left PPRF hota to left gaze is absent hota, isn't it? Left gaze absent hota. If left MLF lesion hota, तो left adduction would have been hampered. So easy question, right MLF lesion which gives me a right internuclear ophthalmoplegia. This is the correct answer. So this is absolutely easy and correct. Now, a young man comes to OPD with a sudden increase in floaters. Okay, floaters बढ़ गए हैं. Now, he has been using glasses since a long time. शायद myopia है. Okay, there is a myopia. There's an increase in floaters. There is also a lot of stress. Okay, he has a dry eye also. Okay, explainable. On examination, the best corrected vision is this and this. So it is supposed to be a high myo, but vision is improving. Now, when I check the retina, lattice degeneration hai, but retinal detachment nahi hua hai. So, guys, if retinal detachment is not here, we can't do pars plana vitrectomy. But if there is a increase in floater and lattice degeneration, I'll just do a laser barrage on the lattice degenerative area. So this is very easy. Please remember, pars plana vitrectomy I'll only do when I have a retinal detachment. Okay, so this one is very, very important. Now, what is correct about cataract surgery? So methylene blue dye can be used to stain anterior capsule. No, no, it is your trypan blue. Viscoelastics are used so that pupil is fixed and dilated all the time. No, viscoelastics can dilate, but it will not produce a fixed dilated pupil. No, no, no. Pseudo exfoliation can cause problems during the surgery. Guys, this is absolutely correct. Because jab pseudo exfoliation hota hai, so there can be a poor pupillary dilatation and there can be a spontaneous subluxation of the lens. So this is very, very easy. Flax doesn't use green laser. Rather, flax use what? Double ND glass laser. So this is also an incorrect option. Okay, so C is my correct option. Now, question number 7 says that we have a 7-year-old child coming with itching discharge every summers. Small child's itching every summers. Definitely, this is VKC. इसी से मुझे पता चल गया कि I am talking about a vernal keratoconjunctivitis. Now, his vision is slightly less. He is allergic to some food products also. Probably I'm giving you a history of some kind of allergy. अभी क्या olopatadine दिया है, but this time his itching is very severe. What is unrelated? So he may develop a bacterial conjunctivitis. He may develop a keratoconus later. This is absolutely correct. Keratoconus हो सकता है. For his accused condition, I can give a low dose steroid. This is absolutely true. He may develop a corneal ulcer. Yes, shield ulcer हो सकता है. But bacterial conjunctivitis, no. Bacterial conjunctivitis का इससे क्या relation है? Why will he develop a infective condition? He has an allergy. So why will he develop a bacterial conjunctivitis? This is an odd man out, guys. Okay. So now, what is not associated with thyroid eye disease? More common with smokers. Absolutely, a very important risk factors, है ना? Now, Jelenic sign is seen. Yes, we have a pigmentation around eyelid. This is also correct. Elevation is first affected. Yes, because inferior rectus muscle is affected in thyroid, so elevation is hampered. This is also correct. And infranasal dystopia is seen. Guys, this is absolutely incorrect because in thyroid, what will we see? We see a axial proptosis. We don't have a dystopia. Dystopia kya hai? Dystopia is a displacement. We don't see displacement. We see a proptosis. This is a forward proptosis. Okay, so this is also easy. Now, ये है थोड़ा tricky. ये क्या है? So it is giving you a retinal image where we see a lot of flame-shaped hemorrhages. But guys, these flame-shaped hemorrhages are actually rod spots because we see a central clearing. If you see this picture clearly, you will have some kind of central white areas. Okay, so this is a beautiful picture of rod spots, and I know rod spots are most commonly seen in cases of infective endocarditis. So this is also simple, straightforward question. Okay. Now, let us talk about another small boy, a 12-year-old boy presenting with visual impairment. There is also a report that child have night blindness earlier. So a boy, night blindness. Quickly, I think about the vitamin A deficiency, or I think about retinitis pigmentosa. Let's see another thing. Child is mentally challenged and having hypogonadism. So guys, if this is retinitis pigmentosa, what syndrome has a mentally retarded child and hypogonadism? So this is a beautiful question. On examination now, the vision is also less. and there are pigmentary degenerative changes also. So this is definitely, we are talking about retinitis pigmentosa. And mentally challenged or hypogonadism किस में होता है? This is nothing but Lawrence Moon Beetle syndrome, because Usher's may I know there is a deafness, Refson's may there is a polyneuropathy, and Treacher Collins syndrome may we don't have retinitis pigmentosa, isn't it? So this is surely a Lawrence Moon Beetle syndrome. Guys, I am sure that you are also answering with me. I hope that you are also answering the same and you are enjoying the test. All right, so we are done halfway. We are short of time. Let's start with the questions. Young man came to you with redness, pain, photophobia. Okay, young man had redness, pain, photophobia. All on examination, the pupil was small but reacting to light. So मेरा question यही खत्म हो गया, because there's a beautiful statement written here. Redness, pain, and pupil is small. So I have to think about a uveitis. Now, there's a non-productive cough also. And she also told that man also told there's a tender nodules on shin. तो ये क्या है? Very clear cut. I'm telling about this is a uveitis associated with sarcoidosis, isn't it? So this is a question where we are giving you a systemic association. Conjunctivitis will never give you a small pupil. Circumcorneal congestion nahi hoga. Endophthalmitis mein you will also have a loss of vision. Okay. And angle closure glaucoma, guys, totally out, because in angle closure glaucoma the pupil will be large, mid dilated, fixed oval. So pupil gives you the diagnosis here. Now, a small boy living in a remote village presented with his mother difficulty in vision during evening hours, as explained by mother as frequent falls. अच्छा, मम्मी कह रही है कि शाम को मेरा बच्चा गिर जाता है, उसको दिखाई कम देता है. So again, a small boy, mummy is complaining of night vision problem. Okay. Examination पे vision is normal, but anterior segment में ये. So guys, anterior segment में I can see something abnormal. This is nothing but the dryness of the conjunctiva. So can I say it's a congenital, uh, it's a not congenital, it's a xerosis, it's a conjunctival dryness, isn't it? Yes. And there is a malnourishment also, so definitely vitamin A deficiency hai. Okay. So white hot spot is the most specific sign. Yes, this is correct. Ask for immunization history. बिल्कुल पूछना चाहिए ना कि विटामिन ए मिला है कि नहीं मिला. Yes. Earliest sign for his condition is ये तो मैंने बोला है, because conjunctival xerosis is the first sign that we see. Vitamin ए 1 लाख देना है. 8 ईयर का बच्चा है तो 1 लाख क्यों दूंगी? 8 ईयर के बच्चे में आई गिव 2 लाख विटामिन ओरल, है ना, इंट्रा international units. So this should be my answer. I have to give 2 lakh international units. So this is definitely the answer. Now question number 13 says a patient came to the hospital with a fingernail injury. Okay. There's a fluorescein staining, epithelial defect with intense photophobia. Agree. Okay. किसी पेशेंट को चोट लगा है एंड दिस एपिथेलियल डिफेक्ट, ऑब्वियसली फोटोफोबिया होएगा. तो मैं क्या नहीं करूंगी? व्हाट विल आई नॉट डू? I not do a saline wash. Not, absolutely not. I don't have to read another option. I'll definitely patch the eye because there is a defect. It will heal on its own. I'll put an antibiotic ointment. I'll give atropine also, maybe to release the spasm and so that the pain is also gone. And definitely I'll give a lubricant wash. तो मैं कभी नहीं करूंगी because there's no foreign body. Washing will only aggravate the things, isn't it? Chalo, fatapat for next question. Let's try with the 14th one. I'm short of time, guys. Patient diagnosed as early keratoconus. Okay, topography pe I diagnosed. Definitely, he's not having good vision through glasses. Okay, so which type of contact lens is best suited for him? So I know in keratoconus, if I have to give a contact lens, it has to be a rose K lens, which are you know, kind of lenses which change the curvature of the cornea. So rose ke to likha hai option mein, rose ke are the lenses that I have to use in keratoconus. Okay, it's a very very important question. Keratoconus itself is a very important topic, guys, so you can't skip that. Okay, question 15 says that's the young female with complaints of decrease in vision. On examination the vision is less. Okay, there was also difficulty in reading the Ishihara chart. Now on retinal examination fundus is normal. So guys, what can that be? It's a beautifully given question. Decrease in vision, vision is less, color vision is affected, but retina is normal. So it has to be optic neuritis, but this is a retrobulbar neuritis because the only statement is fundus was normal. Glioma में ऐसे present नहीं करता. There is a tumor proptosis होएगा. Thyroid ophthalmopathy में optic nerve late stages में affect होता है. Papillitis में fundus will not be normal. So this is a, you know, exclusion wala thing, or you can answer it very very easily. Okay, Question number 16 says that we have an old patient presented with decrease in vision in one eye. There is a systemic history, hypertension, diabetes, and what many things. Confrontation test showed restriction in temporal field. Temporal field right eye ka gaya and nasal field left eye ka gaya. Okay, so this has to be a right homonymous hemianopia. Oh my god, they have given already. Perimetry was done and a right homonymous hemianopia was noted. Of course. Okay, so kaha lesion hai? Obviously left optic tract. We know if we have a right homonymous hemianopia, the problem is on the left side after chiasma, and only left option this is given is left optic tract. Okay, optic nerve mein kabhi homonymous hemianopia nahi hoega. Occipital lobe mein we will think about a macular sparing kind of thing. So this is easy. A young boy came with decreased central vision. Okay, there's a family history also. All right, retina has some pigments. Okay, his ERG and EOG are normal. Oh God. Okay, what is this now? Central vision gaya hai, so I'm not considering retinitis pigmentosa because central vision gaya. Probably they have given us, peripheral night vision problem, है ना? And ERG would not be normal in RP. Road cone dystrophy, definitely ERG, EOG kharab honenge. Stargardt's disease can be one, guys, because Stargardt's may early complaint is decrease in vision, and you get a family history. You have pigments, you have pisiform pigments, fishtail pigments, and ERG and EOG can be normal in early stages, so this one should be out. Best disease में EOG should be abnormal in all the conditions. Stage 1 से लेकर in all the stages, best disease में EOG will be abnormal definitely. So 18 question says that there's an old female, frequent headache, CT normal है. When she came for ophthalmology, everything is normal, pressure is normal. Okay, cups are slightly enlarged, gonioscopy is okay. Visual fields shows defect. So guys, if visual fields are showing me defect, cups are slightly in a suspicion, but pressure is normal, I'll definitely keep it into normal tension glaucoma. I can't say it's a POAG because pressure is in normal range. Okay, no glaucoma क्यों बोलूंगी? Because visual fields are definitely gone. Visual fields have scotomas, that means damage तो हो गया, damage is already started. Ocular hypertension nahi hai, because in ocular hypertension your visual fields should be normal, isn't it? So this is easy because old females may we can have normal tension glaucoma. So this is straightforward going with normal tension glaucoma. All right, now without looking at the question, I'm saying it's a geographical ulcer. If I have this as an option, that's now not how I mark. Okay, but I'll definitely read the question. Whenever I have an image based question, I'll quickly give a read. यंग मैन है, रेडनेस है, टॉपिकल स्टेरॉइड्स ले लिया. ऑफ कोर्स प्रोबेबली ही हैड डेवलप्ड अ वायरल डेंड्राइटिक अल्सर, and now if he has taken topical steroids and this has been aggravated, this is definitely a geographical ulcer, guys, because they have given you a history of steroid usage. Okay, Morin ulcer is a peripheral ulcer. Acanthamoeba ulcer, they might have given you some history of bathing in dirty water or contact lens misusage. And dendritic, this is not how a dendritic ulcer looks like, isn't it? We have knobs there. So answer is very quickly geographical ulcer. But I will say that whenever I have such type of picture questions, I'll quickly go through the options and then I read the question. I don't jump onto the options without reading the question. Beta, okay, this is what we have to do. Right. Next question, my last question. I'm on my last question. A young female came to you with the problem of retraction of her left eyelid. Okay, retraction ho raha hai when she eats or drink. All right, guys, I know the answer. This is Marcus Gunja winking phenomenon, isn't it? Eating or taking the jaw to the opposite side retracts your lid, isn't it? This is Marcus Gunja winking, which has become very irritating to her. Obviously, this is irritating. Chabari, khari, and there's a retraction. This looks bad, isn't it? So it can be due to oculomotor. No, Marcus Gunja winking is not due to oculomotor nerve palsy. It's actually a cross connection. It's also a misdirection, we can say. Mostly seen after surgery. No, surgery is not related. It's a congenital condition. Okay. Thyroid related eye disease. No, it's not related to. They are trying to confuse you saying retraction hai to thyroid hai. No, it's not related to your thyroid. It is a mandibular division of fifth nerve misdirected to the innervator. This is the correct answer. I told you na, there is a cross connection. So LPS, instead of getting supplied by the third nerve, it is now getting supplied by a branch of fifth nerve. So the moment you eat, you take the jaw to the opposite side, this will be there. So I'm marking it for review, guys. I'm submitting my test also. I hope that you also have submitted the test. Have you? And I'm giving my feedback. I'll say it was फायर काइंड वाइल्ड फायर था मेरे लिए तो ये टेस्ट. हाउ अबाउट यू गाइस? It was like very fast because all the questions were super fast and all the questions were problem based questions. So I know all the questions will not be like that. Some questions will be easier on you, but I am a mentor. I know ophthalmology a little bit better than you. So we have kept almost all the questions problem based questions. So I am telling you guys these type of questions maybe they're in your exam, and that is how you have to do. You must know your concept well first. Knowing your concept, trusting your knowledge. You trust your knowledge. मेरे को ये आता है, if I know the one statement, I can rule out everything very very easily. Okay, trust your knowledge, I will say. So this is my feedback. Everything was good. Let's see what they have given me. All right. uh I think I have something on the chat. Students, you wish to ask something, friends? Do you wish to ask something? If you have seen the test, how I solved it as a student, as a mentor, you must be knowing that uh, this is how questions are framed in ophthalmology. They are good questions, doable, but sometimes the options are so twisted, and sometimes we give you very lengthy questions. So guys, don't get scared of those lengthy questions. These are the easier questions because we have given you a lot of options, lot of information within that particular test, so that you can easily uh, easily answer that. Hanji, any doubts, any question? I have difficulty in corneal ulcer part. What to do? Corneal ulcer wala beta, Dr. Devanand Vinod, have you gone through the app? Okay, beta, you're preparing for your NEET PG na, so kindly go through the app once. You have my number. I am there, very much available in all the WhatsApp group. Okay, so whatever problem you have, please write it to me. I can try taking one class on corneal ulcers. We can do that definitely. But whatever your problems are, please write to us so that we can plan further sessions in a way. Okay, how these patients are there. Okay, so beta concept बहुत ही simple है. Whenever you have a corneal problem, any corneal lesion will definitely give you a pain because cornea is a very sensitive structure. Cornea is also a very high refractive surface. So whenever your cornea has a problem, the vision will be disturbed, and definitely it can cause a lot of redness. So PVR, pain, decrease in vision, and redness will be the symptoms. There will be associated photophobia, and a patient comfortable नहीं होएगा, photophobia. So whenever you have PVR, think about cornea related problems. Okay, go through ulcers एक बार. There is a 30 45 minutes video है. All right, Dr. Vinay, go through once the video, and please let me know if you have problem. We can discuss corneal ulcers once. Okay. Hmm. Okay, Dr. Gopinath, thank you very much. And Dr. Indrajit Bhaskar is a very good student. He has attended all our live sessions. He attended all my classes with doing his internship. So I am also a big fan of you. You are managing everything so well, beta. I know you. He's a very good student. So, all of you, my dear students who have listened to me, who have spent a little time on this type of uh, mentorship questions, कैसे मैंने पढ़ाया है ये, कैसे मैंने क्वेश्चन सॉल्व किए हैं, please give a note that you have to give certain time to every question, even for the easiest question. It's not just mark it blindly. No, we give some easy questions as well, but guys, some time should be given to each and every question so that आता हुआ question गलत ना हो जाए, है ना? When we are hurriedly doing it, sometimes our overconfidence, sometimes we are just overlooking that, and we make such kind of silly mistakes. So that is my humble request to all of you. Silly mistakes should be minimized. We all are human beings, we all make mistakes, but those silly mistakes, they kill us at the end. Okay, so minimize your silly mistakes. Okay, have to have a very composed mind, very composed. If your one question is going wrong, not the whole paper is going to be bad. Okay, so you have to be very happy, very calm, very composed during your exam. We all have gone through the exam. आपको लगता है कि आप ही difficult phase में है बच्चा, but we give exams on daily basis. Okay, you will have your exam after 6 months, but we have our exam on daily basis, treating a patient, doing a surgery, dealing with an emergency, seeing a post-op complication. So these are all challenges what a doctor has to face. So life of a doctor is always an exam, isn't it? So this is one exam in your life. I understand that is the most difficult exam of our life that we give. But for us, every day is an exam. Every patient is a different patient, and every patient is an exam going patient for us. All right. So, guys, I just want to tell you, those who are new at DocTutorials, so this is one thing which we are doing at DocTutorials, a test kind of series that we are doing. All the educators, 19 favorite super special doctors are performing one test in front of our students. This is first in our country. Okay, so make most of it at DocTutorials. We have a lot of video lectures and live classes are ongoing these days. So if you are new to that, kindly log on to this. You can access our QRP videos, very nicely done. We have recorded all the QRP videos newly and very nicely. Every faculty has made beautiful videos. I'm telling you, just the gist of all the things. Like in ophthalmology, I have summarized very high yield content starting from basics and to the topmost thing in ophtha in 8.5 hours duration. So kindly go through the QRP videos. This will be very, very useful for you guys. Okay, so make sure that before you give your exam, you are done with your QRP revision plan. Okay, kindly do that. Now, I'm sure you also know that this is India's first faculty created, curated, and a verified Q bank. But yes, we are humans. We also can have errors. Kindly write to us if you see any kind of error in our Q bank. Please let us know, because this is a source of our growth as well. Now, you can have this feature also by DocTutorials, that we have grand test with video solutions. Okay, give your GT, and you need not to spend a lot of hour on reading everything, finding out everything. Just see the video discussions. Okay, every faculty has done it very, very beautifully. You can perform a lot of mini tests also on all the 19 subjects, as I told you. Then we have 2020 test and discussion series, and at a very, very reasonable cost, guys. So subscribe it, hurry up, and because this is only for first 1,000 subscribers. All right, beta, and stay tuned for all the exciting content for your preparation. We have so many educators willing to teach you. Okay, we are very accessible, bache. We are there for you at DocTutorials. And now we have internship skill videos also available. So if you are doing your internship and finding it difficult, or you want to be a pro during your internship, kindly go through these videos as well. So I'm about to end this session. हाँ, अब थोड़ा डर लग रहा है. हाँ, डर तो लगेगा ही, बट डर के आगे भी तो जीत है ना डॉक्टर उत्कर्ष? डर के आगे ही जीत है. सी, डरना तो इट्स अ पार्ट ऑफ आवर लाइफ. लाइक आई टोल्ड यू ना, वी हैव एग्जाम एवरी डे, है ना? सो वो तो सब कुछ करना ही पड़ेगा. लाइक व्हेन आई वाज गिविंग दिस टेस्ट, इवन आई वाज स्कैर्ड. So I have been reading ophthalmology throughout my life, but even I was scared. So डरना तो है, पर ठीक है, मैनेज भी करना है, उसके आगे कॉन्फिडेंस लाके पढ़ाई करना है ना? This is a part of our life. We all have gone through it, and you will also be there. You will also be doing it, isn't it? Hmm. सिंड्रोम्स एफएमजी के लिए डॉक्टर काजल, सिंड्रोम्स यार बहुत सारे. एफएमजी के लिए तो नहीं पढ़ना है. आई विल से यू कैन गो थ्रू डाउन सिंड्रोम, यू कैन गो थ्रू एल्पॉइड सिंड्रोम, देन ऑक्यूलोसेरिब्रोरेनल सिंड्रोम, है ना? देन यू कैन गो विद लोइस सिंड्रोम, थोड़ा सा टीचर कॉलिन सिंड्रोम. बस बहुत है ऑफ्थेल्मोलॉजी में. हाँ, golden heart syndrome. Dr. Kajal, if you are listening to me, golden heart syndrome can be a very important expected question. Okay, there is a lid coloboma wala question. Okay, golden heart syndrome. Yes. Anything else you wish to ask? Okay, Dr. Kajal, not really. Lawrence Moon Beadle syndrome maybe FMG में शायद नहीं पूछेंगे बच्चे. Okay, you can skip that. बट अगर आ जाता है तो आई ब्रीफली टेल यू लॉरेंस मून बीडल सिंड्रोम, वेरी इजी टू रिमेंबर, छोटा मोटा क्यूट गोलू गोलू बच्चा हु हैज मेंटल रिटार्डेशन, ओके, स्मॉल, obese, mental retardation, hypogonadism, brachydactyly with a retinitis pigmentosa association, ठीक है, if at all it comes, but very rare chance, एफएमजी एग्जाम में शायद नहीं आएगा बच्चे, ओके। मार्फन सिंड्रोम तो हमको पता ही है, मार्फन सिंड्रोम बिल्कुल पढ़ना ही पढ़ना है, ऑफ कोर्स। All right. So, my dear friends, I'm about to end this session. Please don't get scared. My FMG students, they are about to give their exam, and I'm very, very, very proud that all my students are preparing very well. I'm getting messages every day that "Oftha to ho jayega, ma'am, baki kya?" But baki bhi to karna hai. All right. So drop a message if you wish to ask me anything here or at my numbers or at any WhatsApp group of the doc tutorials. Okay, tune to with us. We will be there with another mini test with the next faculty. So tune to us at doc tutorials. Kindly attend our live sessions also. Very good sessions we are having these days. So thank you very much. Without wasting much time, have a great time reading with us at DocTutorials, and best of luck, all my dear students, for your upcoming exam. Thank you very much.